be back with a mindful experience. Hope everyone is enjoying this beautiful day, which I hope will extend into the weekend. I haven't been here in a while, so I thought I'd take an opportunity to go over some of the new evidence that's been in on the internet and in the public pertaining to some of the molecules in my favorite medicinal botanical, which is the cannabis plant. And I'll start with COVID because there was a flurry of misinformation in the lay press regarding cannabis and COVID-19 earlier in the year. 2020 came out with a couple of papers that were published, one by Van Bremen et al. At the College of Pharmacy at Oregon State University, showing that cannabinoids CBGA and CBDA prevented infection by the COVID spike protein in human epithelial cells and was equally effective against both alpha and beta variants. And that was pretty exciting news to all the folks who smoke cannabis, but they failed to realize that for one, that the experiment took place in test tubes, and all that happens in test tubes in the laboratory doesn't necessarily translate into animals, and all that happens in animals doesn't always translate into what happens in humans. And then the second point was that CBGA, which is cannabigerolic acid, and CBDA, or cannabidiolic acid, are only found in the raw or dried, unheated plant. So that once the plant is heated by smoking, vaping, or baking, these molecules are converted into CBG and CBD. And while CBG and CBD may have antiviral activity, the study was done on CBGA and CBDA, and I'll share a little bit more information about the medical benefits of these cannabinoids in a moment. And then there was a second paper that has not yet been peer reviewed that came out from the University of Chicago. It was Wynn et al. And their study showed that cannabidiol, or CBD, and one of CBD's metabolites, 7-hydroxy-CBD, inhibited the replication of the SARS-CoV-2 virus in epithelial cells from human lung tissue, and that it also impeded replication from another coronavirus, the mouse hepatitis virus. And again, these are very exciting results, but they are also laboratory studies. And hopefully there'll be more on cannabinoids and their antiviral properties. We've known that these cannabinoids and also a lot of the flavonoids and terpenes that are found in the plant have antiviral activity, but these are the first two studies that really addressed the SARS-CoV-2 virus in particular. So hopefully we'll see some human studies in the near future. And this is a pared down schematic of how all of the cannabinoids are made, and there are a lot more than these few. For that would be a very busy slide. But everything starts with cannabigerolic acid, or CBGA. And I don't know if you can see my pointer, but here's CBGA. And we refer to it as the mother cannabinoid, or the stem cell of all the plant's other molecules. So CBDA and THCA are produced by an enzymatic pathway from CBGA, and then by heat or time, CBDA and THCA are converted into CBD and THC. Now, THCA is analgesic, it's a good pain reliever, it's anti-inflammatory, it has some anticonvulsant activity. It is the purpose of heating the plant and converting THCA to THC, or delta 9 THC, is because THCA does not cross an intact or healthy blood-brain barrier Therefore, it is not impairing, it doesn't give the euphoric high, or for some people, the dysphoric high associated with delta 9 THC. So, THCA is thought, because of its anticonvulsant activity, that it might cross the blood-brain barrier when that barrier is not healthy or when it's inflamed, as it may be in some of the seizure disorders. So sometimes we'll go to THCA when CBD, which is FDA approved to treat seizures in certain conditions like Dravet, Lennox-Gastaut, and tuberous sclerosis. And it's not to say that that CBD doesn't treat seizures in other syndromes or even in idiopathic epilepsy. It's just that the studies were done for those particular syndromes, and so that's where the FDA approval lies. But anyway, there are other cannabinoids that are formed from CBD and delta 9 THC by degradation. And one of those cannabinoids is delta 8 THC. And I'm going to talk a little bit about that one because that one has become quite prominent in the lay literature and in marketing. So there's not enough CBGA left in the plant since it's the substrate for the production of all the other cannabinoids. But CBG can be bred, or the plant can be bred so that CBG is dominant, it can be a dominant cannabinoid by eliminating those enzymes that are needed to convert CBGA into the other acids. But CBG has been found, so there's not much study on CBGA just because you're just not going to see it much. But CBG is a potent anti-inflammatory. It inhibits the release of tumor necrotic factor alpha and interferon gamma, which are pro-inflammatory mediators involved in the exaggerated immune response that we saw or still see with COVID storm, as well as a number of autoimmune disorders like rheumatoid arthritis and inflammatory bowel disease. So it works in much the same way as some of the biological or immunosuppressive drugs like Humira and Remicade. It's also been shown to inhibit bladder contractions, and so it may very well prove useful in treating symptoms associated with things like interstitial cystitis, which is also an autoimmune disease, and bladder spasms or neurogenic bladder. It has been found to reverse the antiemetic effects of CBD, so when using CBD for nausea, it's not such a good idea to use CBG in combination. But it has been shown to have to actually increase the anti-inflammatory benefit of CBD at a particular receptor. It's called the PPAR gamma receptor. And this is another pathway of reducing inflammation. And while I haven't used CBG as an analgesic, and it has been shown to have actually greater pain relieving activity than even THC, I have used it quite a bit for its neuro modulating effect on the GABA glutamate system. And this system, the GABA, is the neurotransmitter that's calming in the central nervous system, whereas glutamate is excitatory. And I treat a fair number of children and young adults with autism, quite severe autism, where these patients have a lot of neuroexcitability as expressed as either seizures or as in aggressive irritability, aggressive behavior, self-injurious behavior, high anxiety. And using CBG in combination with CBD has made a tremendous impact on the behaviors of a lot of these patients. My go-to was THCA or THC for these patients when CBD wasn't doing the trick, but because these autistic patients have a lot of neuroinflammation as well as abnormal endocannabinoid signaling, the CBG combined with the CBD addresses the inflammatory process, as well as modulating that GABA glutamate system, because they have way too much glutamate. And that's why about 35% of all autistic patients also have seizure disorders. And like almost all of these cannabinoids, they're potent. It's a potent antioxidant, and it is neuroprotective. Let's see. So CBDA is another excellent anti-inflammatory, and it works by a different mechanism than CBD. It is a COX-2 inhibitor. And it doesn't seem to show the same type, or it doesn't show any renal or cardiac toxicity that's associated with the nonsteroidal anti-inflammatories like ibuprofen and naproxen. You can't only take those for so long before they start to cause disruption in the stomach or the kidneys. CBDA and CBD both tend to be gastrocytoprotective, which is just a long word for saying that they protect the cells in the stomach so that we don't see the inflammation, or well, not the inflammation, but the irritation in the stomach that we can see with prolonged use from NSAIDs. It also inhibits interferon gamma, and it's also been shown to be anticonvulsant. CBDA is alerting, and this has stimulated some interest in this cannabinoid in terms of investigating it for possibly using it for treatment for hypersomnolence and narcolepsy. It's also antiemetic, and its antiemetic effect has been shown in a few animal studies to be superior to CBD when the nausea is caused by movement or with motion sickness. It, like CBD, is also anxiolytic. It has mood elevating properties, and also in some laboratory studies in vitro in a test tube, not in people, it has been found to have anti-tumor activity against triple negative breast cancer cells. This is a slide that I meant to take out, but since it's here, I'll talk about it. There's been a lot of variability in the responsiveness to medical cannabis in the autistic population, and we actually may be on our way to being able to objectively predict who might respond to cannabis, as well as determine the therapeutic impact of medical cannabis in some of these patients. This is a small 2021 observational study that was conducted by my friend Bonnie Goldstein, and also a friend of Misha's is Don Abrams. And they looked at 15 pediatric patients with autism and looked at the potential of measuring these some biomarkers before and after treatment. And there's certain metabolic biomarker levels that in the saliva of these patients that were found to be abnormal when compared to neurotypical controls. And that they found that by measuring these, and this is too small to see in much more, and I really did mean to take the slide out, but what they found was that by measuring these biomarkers, it had all these abnormal levels. Here you can see it's really too small. I need to fix this. But after treating with, and I believe they used CBD, you can see that all these lines go away. These are just 3 of the patients. I just did this for illustration, but it really can be quite helpful. I think it has the potential to be quite helpful in predicting who of these patients might reasonably respond to cannabis. It gets very frustrating for parents when we treat them, and generally by the time they come to us, they've been on risperidone, aripiprazole, these atypical antipsychotics, which are FDA approved for irritability in patients with autism. They've also been on SSRIs, antihypertensives, all these different benzodiazepines, none of which are FDA approved for treating anything in autism. A lot of these autistic patients have ADHD. Methylphenidate or Ritalin is FDA approved, but it's kind of hit or miss in its efficacy. And a lot of the, and then the only other medication that's really approved by the FDA for treating autistic patients is melatonin for sleep. Melatonin is a hormone secreted by the pineal gland. A lot of these kids have sleep disorders. They have difficulty falling asleep. They have a lot of waking up at night. Melatonin can be helpful, particularly as we age. Our pineal gland isn't producing as much melatonin. So taking a melatonin supplement can be helpful for a lot of people who have difficulty falling asleep. It really is used to reset the circadian rhythm and does very little for keeping people asleep. And so it really is sort of effective with patients with autism. And what happened here? Another slide snafu. So I wanted to just briefly talk about Delta 8 THC because you may see a lot of this in these hemp stores. You may see it in ads online on, I don't know if they have it on Amazon but you'll have friends or relatives who'll say, oh yeah, I got a Delta 8 gummy or a Delta 8 cookie or vape pen. But I would just like to comment a little bit about the cannabinoid itself. It's produced really in very small amounts in the plant naturally because it is a degradation product of delta 9 THC. It has a little bit of a euphoric high, not as strong as delta 9 THC, and somehow this cannabinoid has slipped through the proverbial cracks in the 2018 Farm Bill. So people are converting CBD to delta 8 THC. And what the problem is that you do this conversion, you need acids, and they typically use these chemicals like sulfuric acid to convert CBD to delta 8 THC. It's about moving these double bonds in this ring on the molecule. And you can convert delta 9 to delta 8 THC, and that does occur naturally in the plant to some extent. But the delta 8 that's being produced and marketed is not produced naturally. It's a chemical, and in the process of producing this delta 8, the conversion is producing a lot of peaks in these products that nobody knows what they are. So a lot of these products have a lot of other man-made chemicals in them that we have no idea what they are. We have no idea what their effect is on the brain or any other organ. And so my message to everyone is to hold tight, don't jump on the delta 8 THC wagon because we really just don't know what it is in these products. So that was about all I had to say. I usually am told that I only have 10 minutes and I usually have like way more. So this time I got it down to 10 minutes and then I was told I have more time so I can take questions if anybody has any.
Does anybody have any questions for Dr. Frye? If you don't want to type it into the chat box, you can unmute yourself and just ask her directly.
I have a question. Where can you get good products, CBD products that are, do you sell them at your office?
Well, actually, yeah, there are a few brands that I do carry. I carry one that I've been using for about 7 years. That's CBD, CBG. It's CBD with some CBDA. They have a small amount of THC in them, not so much that makes it illegal to have them, but sometimes just a little bit of THC can help everything work better, but you certainly aren't impaired from it. I also carry some brands that I have a lot of confidence in, and I don't have a lot of confidence in many. Healer is one, Miriam's is another, Harmony is another, Charlotte's Web, and all of those brands can be purchased directly from the companies online. But I generally stock the healers. I usually have healers, CBD, CBDA, CBG. I stock Miriam's, and then I have kind of a white label CBD, CBDA, or CBD, CBG, and I do have those. I have those available for my patients, or if somebody wants to use them. I generally I don't really advertise as selling cannabinoids, but oftentimes I'm waiting for certifications for some of these programs, DC, Maryland, Virginia. It can be a month or so before the patients have access, and I sometimes will treat like chronic pain with these cannabinoids combined with a synthetic pharmaceutical cannabinoid. Well, it's actually THC in a prescription form. So that's why I keep them handy. So I hope that answers your question.
Thank you.
Mm-hmm. Okay, I see something in the chat.
Okay. Oh, I have a question. I don't know where to go raise my hand.
All right.
Okay, I have Miriam CBD plus CBDA, but it's mixed with a lot of olive oil, and I really find it difficult to take it sublingually. What can I do?
Well,
Maybe you don't deal with that.
First of all, the next time you
oil.
order it, you
Huh?
can get the MCT. I said the next time you order it, it does come in MCT oil. But the reason it's in olive oil is a long chain fatty acid, and laboratory studies have shown that the absorption is better with olive oil than with anything else. So that's why they make it in olive oil. If you don't like the taste, then I would suggest getting a spoonful of a healthy fatty food like hummus or guacamole or a piece of avocado, smash up some chickpeas, something that has some fat, some plant-based yogurt, something. Put the drops in that and eat it on the spoon. Let it hang out in your mouth for a few seconds before you swallow, and you could take it that way, and that will help the absorption.
Okay, good. Thank you.
You're welcome.
I appreciate it. Thank you.
Okay, there's a comment here. CBDA seems like it could have potential to treat long COVID. I agree. I treat long COVID the same way I treat autoimmune illnesses like Lyme, any type of post-infectious autoimmune process, PANDAS, Lyme, long COVID. You still have an abnormal immune response going on with these cytokines like tumor necrotic factor alpha and interferon gamma and interleukin 1 beta, and CBD and CBDA do have these they suppress the release of these pro-inflammatory molecules and enhance the production and release of anti-inflammatory cytokines in the body. So I agree. I use them a lot. Can CBG and CBD be effective in someone with Hashimoto's and hypothyroidism? And that's an interesting question. And I see a lot of autoimmune disorders, and I see improvement in a lot of symptoms. I don't, to this date, I haven't seen a lot of improvement with thyroid function with patients with Hashimoto's, but I just read something, and it was either CBG or CBDV. There was one of the two, that there was something going on where they were looking at possibly using that in Hashimoto's disease. So I'm going to have to look back at that. It was one of those things I just kind of flew past, and I can't remember if it was CBG or CBDV, but it very well could be CBG. No,
Dr. Frye,
data.
was that something you read in the journal?
Yeah, I was on PubMed. I was looking for something, and I ran past that. So I'll have to go back and look specifically, and maybe I can, if I find it, I can send it to you, Jeanette, and you can send it to uh, Monica Stassen.
Yeah.
So let's see. Um, and hello, Jacqueline. Been trying to reach my office. Yes, I take new patients. Yeah, www.tacomacare.com. I'm still doing telemedicine, not quite back in the office, but yes, I am taking new patients. Thank you.
Okay, so I think on that note, that's a good place to
To stop.
transition, and I'll make sure to have Dr. Frye's practice website in the email that I'll send you all afterwards. Okay. So thank you so much, Dr. Frye. It's always a pleasure to have you here with us.
Thank you.
All right, Viktoriya, it's your turn.
All right. Well, thank you for having me again. It's good to see a lot of familiar faces. So today I'm going to talk to you about mind-body techniques. And one of the simplest and most accessible one to all of us is tapping. Tapping has roots, I think, that are very primal. When something is hurting, we tend to touch that place. We tend to maybe rub it gently, trying to relieve that pain or discomfort. So tapping originates from that need to alleviate emotional and physical suffering with something that would have calming effect on our nervous system. So if you look at the research around tapping, it's actually very promising. In fact, tapping is considered evidence-based practice for helping with things like anxiety, PTSD, depression. And the way it works, it actually lowers the body's level of cortisol in our body. It also signals to our amygdala, and kind of to turn off the fire alarm, so to speak, when we kind of go into fight or flight response, when we are feeling anxious or stressed. So by doing repetitive calming movements with our hands or our body as a whole, we signal to our amygdala that it's all right. Things that were previously feel dangerous are not really a threat to us anymore. So a little bit of an interesting history about tapping. There is a technique that's called emotional freedom technique that is based on tapping, and it was attributed to some work that was done by Gary Craig, who developed it around 1995. But before Gary Craig, there was another practitioner, and his name was Dr. Callahan. And I want to share like a really interesting story of his patient who actually started the whole thing. Her name was Mary, and she had a very overwhelming fear of water. She couldn't even get into a bathtub without anxiety attack. And Dr. Callahan worked with her a very long time with a minimal progress. He used all sorts of different techniques, nothing worked. And one day while he was working with her, she complained about a feeling in the stomach that was uncomfortable. So Dr. Callahan had some training in acupuncture, and he said, okay, well, let's have this acupuncture point located beneath the eye. Which is linked with the stomach meridian. So he asked her to tap on that point, and she did a couple of rounds to balance out her meridian energy system. But neither he nor she actually expected the result that it produced. Instead of alleviating that stomach pain, she actually started feeling less anxiety about water. And Dr. Callahan was skeptical about her statement, and she said, well, let me show you. And because they were having their session in his house and there was a pool in the back, she ran to the pool and and was able to touch the water and feel very comfortable visit. So Dr. Callahan started doing more research on it and discovered that a lot of acupuncture points that are used in Eastern medicine could actually help with alleviating feelings of anxiety, high stress, trauma, etc. And then Dr. Craig took it from there and developed various types of sequences that we use right now to help patients. So I want to run through a sequence like that with you guys and see if this is something that you can take with you and use in your daily life. We are all facing a lot of stressors right now. I mean, just pumping the gas or going to a grocery store is a source of stress for many of us. There are lots of things that are going on in the world that are also sources of stress. So what I want you to do, I want you to think about things that are distressing for you. And before we go into a tapping sequence, I want you to take a mental note of how distressing that thing is on a scale 0 to 10. 0 being not distressing at all, 10 being, super distressing. And I would suggest, choosing something moderately distressing. We don't want to go all the way maybe to, most distressing thing, just to test how that would work. Okay. So whatever your number is, write it down or make a mental mark for yourself. And then we're going to be using our fingers, just like when I was showing Mary's story, I was tapping under my eye. So we will be using a couple of our fingers. You can use 2, you can use 3 or 4, whatever feels right for you, to stimulate certain points in our body. All right. So I want you to first take a deep breath, calm yourself down. We're thinking about that distressing thing that has been on your mind. And we will start with what's called a karate point. And it is located on the side of your hand. And again, since this is a fairly big portion of your hand, you can actually tap with all 4 fingers like that to stimulate it. And it doesn't matter which arm you use, you can use both and alternate if you want. So, and when you are tapping, I want you to start with the setup statement. And setup statement is going to sound something like that. Even though I feel whatever that feeling is, stress, anxious, overwhelmed, I unconditionally love and accept myself. So let's do a few taps like this. You can do it on both arms and repeat that in your head. If you're doing it by yourself, you can repeat it out loud if that helps. So there is no right or wrong way to do it. Do it as it is comfortable for you. So even though I am feeling stressed, I unconditionally love and accept myself. Then we're going to move to the next point that is located where your eyebrows kind of start. So it's right here. And again, you can tap with 1 finger, with 2, whatever is comfortable for you. And you can alternate the sides if you want. And what are you going to be doing? You're going to be recognizing what you're feeling. It's almost like playing the script that you're probably already saying to yourself when you are feeling that. Like, the feeling is overwhelming. I am very stressed. So you're going to be recognizing that feeling without judging it, just acknowledging that it exists. All right. In our previous talk, remember guys, I talked to you about RAIN acronym. how we recognize something, we accept it without the judgment, we investigate it. So that's the type of mentality that I want you to use while you're tapping. So recognize it without judgment. Though I'm feeling stressed, then we're gonna move at the end of our eyebrow. And this is your next point where your corner of the eyes are, okay? So you can tap on it. And again, you can alternate if you want. And you're gonna, again, acknowledge the feelings that you are having. You know, too much stress, too much on my mind. It feels overwhelming. So as we move through the eyes, we're gonna circle, kind of make a full circle and go right here, that famous stomach point that produced healing in that patient, Mary, okay? So under your eyes and tapping right here, and again, recognizing what's going on. Too much stress, I am feeling anxious. I know it's too much for me to handle. Then we are moving down to under our nose. It's between your nose and the lip. This is the point right here. And again, you can use one finger, you can use two, whatever feels good. And again, acknowledging those feelings. And kind of almost making it safe to feel it that way. I know that part of the technique working so well for many people is that very often we are unable to accept our feeling, and that keeps us stuck in one place. So by accepting it and feeling safe with them, that's what kind of start moving things. So it's safe to feel that way. It is what it is for me right now. Then we're gonna move in this area between your lip and your chin, right here. And we're gonna continue tapping and repeating to ourselves that this is the feeling I have, and it's all right to feel that way. We are moving down to our collarbone, and different people, there are different recommendations on how to do it. Typically, you take about an inch on the side and about an inch down here, and that's where you tap. Some people prefer to have a tap like this. In this area, very often, this is where we like put our hands when we are having strong emotions of different kinds, right? Just holding it in our chest. So this is how you can do it. Is the whole hand tapping here, or maybe with your fingers tapping 1 inch under your collarbone. All right, and again, repeat that statement that it's all right. This is what I am feeling. I am feeling safe experiencing it. We are moving down our armpit, and ladies, this is about where your bra starts. Gentlemen, it's about like a palm this down your armpit. So you can tap there on either side, however it's convenient for you, repeating that statement. It's safe to feel that way. Even though I am stressed, it's gonna be all right. And then your last point's gonna be on top of your head right here. And again, you can alternate hands if you want. You can use a few fingers, you can use all 4 fingers, however you like. So that would conclude the 9-point sequence that Dr. Craig invented as a part of this emotional freedom technique. So you start, again, just to run it fast for everybody, you start here on your karate point, you move here where your eyebrows, then the corner of your eye, then under your eye, under your nose, between your lip and the chin, where your collarbone is either here or like this, under your armpit, and then on top of your head. All right, so that would conclude the 1 round that you will run. Okay, so notice when we were running this 1 round, we were mostly focusing on the emotion that you're feeling. All right, So what we were trying to do, we were trying to desensitize it so it's not as acute. Now, doing the second round, we're going to focus on a positive affirmation for ourselves. Remember when we started our setup statement, we said, even though I feel anxious, or even though I feel stressed, I unconditionally love and accept myself. So we're going to focus on the second part of that statement, that unconditionally loving and accepting yourself and believing that it's going to be all right. So you finished your sequence here. You're not going to go here with the starting point. You're going to move straight to the corner to where your eyebrows begin, and you're going to start with affirmation. I know I have supports I need to go through it. Even though it's a lot, I know it's going to be all right at the end. I have what it takes to succeed and persevere. Stress is unavoidable. And it's not good or bad. This is what I do with it. So giving yourself positive affirmations that would instill that feeling of confidence in yourself. It is safe for me to be where I am, and I have strengths to move forward. I love myself no matter what happens. And I know there are people around me that love and accept me too. Again, even though that stress is here, I know it's gonna pass and it's all gonna be good at the end. Even though it's overwhelming, I'm gonna get through it stronger. All right, so that's your second run around with the positive affirmations. And then what I want you to do is to check back with your level of stress or anxiety. So maybe you started with 6, but you ran a couple of rounds and then you're checking back with you and it became maybe 3, maybe 2, maybe none. The truth is you cannot go through this sequence and worry at the same time. There's too much going on. I mean, though our brain is insane and it can do a lot of things at the same time, it cannot worry and focus on the sequence and the affirmations and remembering where to go and worry at the same time. So whether or not you do it in the right order, it really doesn't matter. Even if you skip some point, it also doesn't matter. What matters is really you giving yourself the soothing rhythmical movements and stimulation that activates that calm response from your brain that it's all going to be all right at the end. All right. So that's something that I want you guys to take with you. And when we are done, I'm going to send to Janet. Actually, Gary Craig published a free accessible to everybody protocol for emotional freedom techniques. So anyone can access it. You don't need a therapist to administer it. It's something that is a self-help tool and all of us can use. All right. So that's one kind of thing that I wanted to share with you. There's something else that is also very effective and simple to implement. When you're at the workplace or when you're in a public, obviously you're not going to run this sequence. It's too complex. That's something that you do, in the privacy of your home, but not necessarily something you can use immediately in public when you're feeling a certain way. So there's another technique that is called a butterfly hug. And this is actually a very interesting one, and it was discovered by 2 social workers, therapists, Lucina Artigas, and she worked with the survivors of Hurricane Pauline in Acapulco, Mexico in 1998. And she also had another therapist, Guerrero, who was working alongside with her. So both of them used this technique and they found that it helped tremendously especially with children that were victims of that hurricanes. So I want to show you this technique. It has different modifications. It can be used in, even in a public situations. So why is it called butterfly? Because originally when they were showing kids how to do it, they say, okay, you're going to create a butterfly with your hands and you're going to put it on your chest and you're going to tap. And all kids got excited and this is something new. So they were tapping, doing this butterfly on your chest. But there are easier modifications. So you really need to go with what feels comfortable. So you can just simply hug yourself like this. You can position your hands how it fits. And again, and do bilateral tapping. So the trick is you're not doing it like this. You're doing it like this. You do one and nurture, one and nurture. And you're doing it and you're finding the pace that feels comfortable. It takes a little bit of time to adjust and find out what that is for you. Some people pair it up with a gentle body rocking. So you rock your body a little bit. You can rock it side by side like this, and then you gently tap. So again, both are repetitive movements. Both have very calming effect on the brain, and both kind of stimulate a production of delta waves that are appearing as a result of a very deep relaxation state of our body and mind. There is another alternative to just hugging yourself and doing it like this or like this. You can put your hands on your lap, or you can put it on the surface of a table if you want. I mean, typically we want a body contact, but if you don't want that, you can also do it on the surface of the table. You can do it with your feet on the floor like this, okay? So whichever modification fit your environment and needs, you can utilize. So when you're doing that tapping, and I want you guys to try it, you're going to take a deep breath, you're going to hug yourself, and you're going to start your sequence. And you can pair it up with, in addition to deep breathing during tapping, you can pair it up with some statements that are affirmative. Just like we did with the tapping sequence that we did prior, there was, unconditional acceptance and love. You can bring those statements to yourself as you're doing it. For example, I feel relaxed and calm. I am safe where I am. I am surrounded by good people and good energy. Things like that. That kind of help that tapping to be more kind of embedded into your neurological pathways. And I see that Dr. Frye is saying the butterfly hug is a reminiscence of what we do to babies and children when consoling them, patting and rocking. Absolutely. This is a wonderful observation. And actually, since we are going back to when the butterfly hug was used first, again, remember, those are people that were victims of a hurricane. So they went through a lot of devastation and trauma, etc. So what they suggested for parents to do, you hold your children and you gently do this tapping. And then when they had to be separated, because a lot of times there were situations where kids had to be separated by parents, they were saying, well, give yourself a butterfly hug from, to yourself to remember, that I love you. So absolutely, a lot of those movements are very intuitive. We do them subconsciously, because that's very kind of a raw way to express love and acceptance, to each other, as parents, as friends, and acceptance to ourselves. What you can also do with this butterfly hug, you can use it as an instrument to install a certain feeling that you desire. For example, and again, I work with both kids and adults. You can have a security object, whether it is, I don't know, I have this nice teddy bear here. So, I mean, it could be something else. It could be a favorite blanket. It could be, I don't know, something that gives you that feeling of comfort and love, and you can hold it near yourself and you can hug it and do that gentle tapping with the message of calm, love, acceptance, etc. You can also do it with your favorite smell, for example. If you have, I don't know, I love the lavender smell. So just putting a little bit, you know, in places where you can feel it and smell it, and having that sequence with the butterfly hug and repeating that message of, yeah, I'm able to experience the fullness of life when I am smelling this, right? I am happy when I am smelling it. So cueing that smell with a word and using the butterfly hug to install that feeling can also help you to brain it when you need it. So those are some helpful tips for mind, body techniques that you can use. Another last one that is very simple is a hand washing movement. This is another one that has amazing calming effect on our minds. It activates delta waves in the brain. So this is something that you're putting lotion on your hands. That's a very meditative and calming experience. And this is, you know, this movement also has a lot of power and a lot of kind of a deep, very primal meaning as we do that. So I think I'll pause. I know we're almost at the end of our time. I want to.
Viktoriya, do you see the question?
Yes, I do. So I heard of someone treating the OCD for good through tapping. Have you heard of tapping used this way, or other examples like that? Well, tapping, believe it or not, has a very wide range of applications. So I will not be surprised if it was used for that purpose. If you listen, I mean, after this session, if you go on YouTube and listen to Dr. Gary Craig, because he has a lot of various information out there, you will see a scope of emotional freedom techniques being used so widely that you can be amazed. Dr. Craig believed that our emotions, and this is true, produce physical symptoms, right? So it's all right if this is like maybe one occasion and it doesn't develop into anything chronic, but if it's a feeling that is contained, unexpressed, unaccepted, it will develop into a disease. We hear a lot about psychosomatic conditions. So this can be an excellent point to use those techniques, but there are also situations with pain, for example, where those techniques can be very, very effective. And I am a witness of it because I have severe migraines, and tapping is what I use along with visualization to cope with them instead of being on medications, that I have to take almost nonstop. So this is something that, again, has a wide range of applications, and I hope that you'll explore it more. I'll send the protocol with, with Janet so she can distribute, and good luck to everybody visit.
Well, this was a really informative, not that they're not usually informative, but there was a lot of really great information this week. And I hope everybody will open up the video email that I send you and watch this over again, because I really think to get all of this great information that Dr. Frye and Viktoriya gave you, you're gonna definitely need to do that. Okay, well, thank you, Viktoriya. Thank you, Dr.